Today's health alerts, a new study suggesting that 1 in 14 hospital patients may fall victim to harmful diagnostic mistakes. And most of these errors could have been prevented. Our chief health editor, Dr. Partha Nandi, here with us now to talk about this troubling news and also what were the most common errors. And in fact, did anyone die from this?
Yeah, this is important stuff, right? My family experienced something similar to this years ago, Simon, when my dad was in the hospital. A nurse almost gave him a shot that could have caused him serious harm if I had not been there to intervene. Now, this study we're talking about that was published in BMJ, Quality and Safety, found that 85% of the errors could have been avoided. That's important. Researchers randomly selected 675 patient cases from a Boston hospital between 2019 and 2021, and they discovered diagnostic errors in 160 cases involving 154 patients. And here's where the highest number of diagnostic errors happened. 54 were transferred to the ICU, the intensive care unit. 52 involved patients with complex medical issues. 34 involved folks who died within 90 days. And harmful diagnostic errors were identified in 84 cases involving 82 patients. And among these, 28.5% occurred in intensive care transfers, 13% in patients who died within 90 days, and 8% occurred in patients with complex medical issues, 6% involved in low-risk patients. As for what were the most common errors, they involved heart and kidney failure, sepsis, pneumonia, respiratory failure, altered mental state, stomach pain, and low oxygen levels. Older and non-Hispanic white patients on public insurance were at the highest risk for preventable diagnostic errors. But keep in mind, this was one observational study of patients receiving general medical care at one hospital, so we shouldn't interpret this to everybody, and you take the results with caution.
Now, this sounds like 7% of patients nationally. What can we do to prevent this and to look out for ourselves?
That's an important question, right? So patients can certainly help prevent diagnostic errors, and here's how. So it's important to look at this. Share your full medical history. Make sure you tell your doctor about any medications, past diagnosis, and family health conditions. And keep copies of your medical records and check for any mistakes. If something doesn't look right, make sure to get it corrected. Tell someone. Ask questions. If something doesn't seem right, ask for explanation or more tests. And track your symptoms. Keep a detailed record of when symptoms start, how they change, and what makes them better or worse. And if you need to, get a second opinion, right? If you're unsure about a diagnosis, ask another doctor for their perspective. Double check test results. Always follow up on your results and make sure you understand what they mean. Listen, being involved and proactive can help reduce the risk of errors. However, super important for hospitals to step up their monitoring. Take a look at these results, right? Researchers suggest that maybe AI tools, Simon, could improve oversight and trigger timely interventions to minimize these errors, because they're preventable. If you're preventable, you want to go to the hospital to get better, not to get worse.
Yeah, got to be informed on this to keep yourself safe.
Exactly, be proactive.
Yeah, thank you, Doc.
Of course, my pleasure.
And coming up this Sunday, October the 10th, Dr. Nandi explores the harsh realities of living in poverty and its profound effects on those impacted. He sits down with key figures from Detroit's Habitat for Humanity, Covenant House, and Matrix Human Services. Together, they shed light on the challenges of poverty, discuss available programs, and offer actionable ways to make a difference in your community. Again, that is Sunday at 1 p.m.